Hey, I'm Anastasia. This is Anastasia's Hump Day Happenings, and today's question was from a viewer asking, what are the oral side effects of living with asthma? There's a lot of triggers for asthma. So basically what it is, it's a chronic inflammatory condition where a trigger is set off and all of a sudden your airway, your passages, they just constrict. It's like, not today, and making your air just to breathe extremely difficult. So it's important to know that this individual is either taking an inhaler, a bronchodilator, corticosteroids, or an anticholinergic drug. In saying that, here's two things that we need to ask in the profession. What is the frequency? How often do you have these episodes? And number two, what's the duration? It's very helpful to know that because that will guide us to the next two things. Oral side effects, top two with people living with asthma because of inhalers, which contribute to dry mouth, are number one, enamel erosion, and number two, tooth hypersensitivity. Your enamel, eventually, it will go away. You don't grow back enamel. So in knowing that, you can have hypersensitivity. And what that is that's going down to the next layer into the tooth, and it's called dentin. Now, dentin is like, it looks like a straw. So it's going, whew. And you know what? It depends on the fluid in there, whether or not you feel the pain. I don't want you to feel the pain, because in this instance, it's not no pain, no gain. I'm just here to tell you, you need to know the pain in order to know how to gain it, and that's KNOW. Here's what we need to ask you. Number one, what's your current state of oral health? Are you more prone to cavities? Because that will also contribute to tooth sensitivity. Do you have a lot of gingival recession? Did you have gum disease? Those kinds of things. More importantly, let's start with enamel erosion. We can remineralize and make that enamel stronger or stop it from eroding more. Diet. Really important about your diet. So after you have these episodes, what are you drinking? Is it water or is it a carbonated beverage, a high sugar content beverage? Is it an energy drink? Is it a soda? Is it a juice with a bunch of sugar in it? What are you consuming that drops that pH and doesn't help your dry mouth out at all, actually? I'd say power brush. I would say get something in between your teeth. It doesn't have to be floss as long as you're disturbing the plaque, removing the food. You might want to get a fluoride mouth rinse, and then you may want to ask, hey, do I need a prescription mouth rinse or a prescription fluoridated toothpaste? Because there are options. Ask your dental hygienist, dental professional. I've got sodium fluoride choices I understand, and I've got stannous fluoride choices I understand. Which one's going to best benefit my current state of oral health? Being that I've got asthma, I use the inhaler, frequency, duration, and it's contributing to enamel erosion and hypersensitivity. These are things that you really need to know about, so I'm glad you asked that, and I hope it gives you some guidance for your next health and wellness visit with your hygienist. Now you got a question for me? Ask it. Hashtag Ask Anastasia, like this channel, and join me next week. Until next Wednesday, take what you learn and make a difference with it.